The cerebrum, cerebellum, and basal ganglia all help coordinate movements, so movement disorders can be traced back to these structures. Broadly speaking, there are hypokinetic disorders which cause slowness of movement, and hyperkinetic disorders which cause excessive involuntary movement. We'll be talking about hyperkinetic disorders. First up is tremor, which is an involuntary rhythmic movement of a body part, and is the most common of all the movement disorders. Tremors can be classified into resting, postural, and action tremors. Resting tremors develop when the affected body part is resting, and is gravity dependent, and they usually disappear when the person starts a voluntary movement. Action tremors are further grouped into kinetic tremors and postural tremors. Kinetic tremors are simple if they happen uniformly throughout a voluntary movement, intentional if it worsens as the affected body part approaches the target, and task-specific if it happens during a specific task, like writing. Intention tremors are often associated with a problem with the cerebellum, and can accompany other cerebellar signs like ataxia and dysmetria. Postural tremors occur when the individual is in a specific position, like extending their arms out. One very specific type of tremor is called a flapping tremor, or asterixis, and it's induced when a person fully extends their wrists. In a flapping tremor, a person will flap their wrists, like a bird flapping its wings. It's a classic sign of a metabolic disorder, like hepatic encephalopathy and liver disease, uremic encephalopathy and kidney disease, and carbon dioxide retention in lung disease. A specific and extremely common tremor disorder is essential tremor. It's thought to be inherited in an autosomal dominant way, although there can be incomplete penetrance, meaning that some affected individuals might not develop all of the features. Individuals with essential tremor usually develop a unilateral or bilateral postural and kinetic tremor in their arms, face, and head, including the vocal cords, leading to problems with speaking. The tremor is often worsened by caffeine, emotional stress, and hunger. Interestingly, individuals with essential tremor often self-medicate with alcohol, which can relieve the tremor. The mainstay of treatment is a beta blocker like propranolol. An alternative option is primidone if propranolol cannot be given, like in chronic obstructive pulmonary disease or asthma. Now, a dystonia consists of an involuntary, sustained contraction of a muscle group that results in abnormal twisting movements or postures. Dystonias can be classified into focal dystonias, involving only a specific muscle group, or generalized dystonias, which involve multiple muscle groups. Examples of focal dystonias include blepharospasm, which is spasm of the eyelid muscles, which causes an increased frequency of blinking. Another example is a cervical dystonia involving the sternocleidomastoid muscle, and causes the neck to deviate to one side, and cause torticollis. Limb dystonias are often brought on by specific tasks. For example, writing can cause a writer's cramp, or golfing can cause what's called the yips. Medications that might be used include muscle relaxants like baclofen, levodopa, or anticholinergics. In some situations, injection of botulinum toxin can help relieve a dystonia. An important anesthesia consideration is that individuals with a history of dystonias can sometimes develop persistent vocal cord spasm that can lead to airway obstruction, especially during stressful situations like surgery. Alright, now athetosis is an involuntary, slow, snake-like movement of the limbs. On the other hand, chorea are involuntary, random, rapid, dance-like movements. And when they happen together, they're described as choreoathetosis. Chorea can be seen in Huntington disease, an autosomal dominant neurodegenerative disorder, caused by a trinucleotide repeat of CAG sequences in the Huntington disease, or HD gene. In Huntington disease, there's a phenomenon called anticipation, which is where there's an increased number of trinucleotide repeats in subsequent generations. This leads to an earlier onset and more severe presentation of the disease. Individuals often have chorea followed by cognitive symptoms, like dementia, and psychiatric symptoms like depression or psychosis. Diagnosis is confirmed using polymerase chain reaction of the HD gene, which shows the CAG repeats. MRI imaging of the brain characteristically shows atrophy of the caudate and putamen, and enlargement of the lateral ventricles. There are no current medications for Huntington disease, but there are clinical trials looking at the use of antisense oligonucleotides which can bind to Huntington messenger RNA as a potential treatment. However, symptomatic treatment can be provided by giving muscle relaxants like tetrabenazine for the chorea, cholinesterase inhibitors like donepezil for the dementia, antidepressants for depression, and antipsychotics for psychosis. Chorea is also a feature of other diseases, like acute rheumatic fever and lupus. It can also happen in metabolic conditions, like thyrotoxicosis or acute hyperglycemia, or even in pregnancy, in which case it would be called chorea gravidarum. Finally, a severe form of chorea is called hemibolismus. That's when there are wild, flingy movements of a limb on one side of the body, due to a lesion in the contralateral subthalamic nucleus in the basal ganglia. A myoclonus is an involuntary, brief, rapid, shock-like, jerky movement. A good example of myoclonus is that of the diaphragm, which we would call a hiccup. Similar to dystonias, myoclonus can be generalized or focal. Important diseases associated with myoclonus include the Creutzfeldt-Jakob disease, which is a pre-unborn illness that results in rapidly progressive dementia in myoclonus. There's also opsoclonus myoclonus syndrome, which is when there's rapid, erratic dancing eye movements along with limb myoclonus, and is often also associated with ataxia. This is classically a paraneoplastic syndrome associated with neuroblastoma, which can develop in children. Myoclonus can also be a feature of juvenile myoclonic epilepsy, which is a seizure disorder that affects adolescents. Individuals with juvenile myoclonic epilepsy present with myoclonic jerks in the morning, followed by generalized tonic-clonic seizures. Treatment includes anti-epileptic medications like valproic acid, lamotrigine, or levetiracetam. Finally, a mitochondrially inherited disorder called myoclonic epilepsy with ragged red fibers, or MRF, classically causes myoclonus and muscle weakness. Finally, tics are involuntary, brief, purposeless, stereotypical movements that typically involve the head, face, eyes, mouth, and neck. Tics are broadly classified into motor and vocal tics, with each group subclassified into simple and complex. Simple motor tics involve one muscle group, like twitching of the nose, while complex motor tics involve multiple muscle groups, like jumping or head banging. Simple vocal tics tend to manifest as grunting, barking, or throat clearing, while complex vocal tics involve words, phrases, or sentences. Motor tics also include echopraxia, which is mimicking the movement of others, or copropraxia, which is expressing inappropriate gestures. Similarly, interesting vocal tics include echolalia, which is repeating the words or phrases of others, palilalia, which is repeating one's own words, or coprolalia, which is verbally expressing obscenities. The major difference between tics and any other movement disorder is that although tics are involuntary, the individual can anticipate when the tic is about to happen, and can voluntarily suppress them to a certain degree. Additionally, tics are accompanied by an irresistible urge to let the tic happen. In fact, the longer the individual holds in the tic, the more intense the outburst will be, kind of like trying to suppress an itch. Now, the most important tic disorder is Tourette syndrome, a genetic disorder that affects boys more than girls and children more than adults. To diagnose Tourette syndrome, 3 criteria must be met. First, the individual should develop at least 2 motor tics and 1 vocal tic. Second, the onset of symptoms must be before 18 years of age. And third, the individual should have the symptoms for over 1 year. Interestingly, Tourette syndrome is often associated with psychiatric conditions like ADHD, OCD, and autism spectrum disorder. Medications for treatment of Tourette syndrome include alpha-2 receptor agonists like clonidine and guanfacine, typical antipsychotics like haloperidol, and atypical antipsychotics like risperidone and olanzapine. Alright, now restless leg syndrome is characterized by discomfort in the legs when resting or falling asleep, an urge to move the legs, and immediate relief after moving them. Interestingly, restless leg syndrome has been associated with iron deficiency, and therefore individuals should be screened by checking ferritin levels. If ferritin levels are low, individuals should be given iron supplements. In addition, treatment includes dopamine agonists like pramipexole and ropinirole, or gabapentin. Finally, there's Wilson's disease, which usually causes liver disease, and psychiatric changes like personality changes, depression, or psychosis. However, some individuals can develop an isolated movement disorder. Therefore, any individual less than 40 years of age with a movement disorder like tremor, chorea, or dystonia should be evaluated for Wilson's disease. This includes performing a slit lamp ophthalmoscopic examination to look for Kaiser-Fleischer rings, and measuring 24-hour urine copper and serum ceruloplasmin levels. In Wilson's disease, individuals have a high urine copper level and low serum ceruloplasmin level. Treatment includes copper chelating medications like penicillamine or trientine. Alright, as a quick recap. Movement disorders are broadly classified into hyperkinetic and hypokinetic disorders. A tremor is an involuntary, rhythmic, oscillatory movement. Essential tremor is the most common hyperkinetic movement disorder, and is treated with propranolol or primidone. Other types include intention tremor, which is found in cerebellar disease, and flapping tremor, which can be found in various metabolic disorders like hepatic encephalopathy. Dystonia is an involuntary sustained contraction of one or more muscle groups, and can be classified into focal or generalized dystonia. Chorea is an involuntary, rapid, dance-like movement, and can be a feature of Huntington disease, lupus, or acute rheumatic fever. Myoclonus is an involuntary, rapid, jerky movement, and can be a feature of many diseases, like neuroblastoma and Creutzfeldt-Jakob disease. Tics are involuntary, stereotypical movements that can be vocal or motor. An important tic disorder is Tourette syndrome, which is often found in children. Finally, Wilson's disease should always be considered in any individual less than 40 years of age with a movement disorder.